Welcome back, future nurses. Today, you're getting 50 of the most confusing and clinically realistic endocrine Nclex questions you will ever see. These are the exact kinds of questions that test your ability to think like a nurse, not just memorize facts. Each question comes with rationales and strategies that train your brain to identify patterns the Nclex loves to hide. So, grab a pen, stay focused, and watch all the way till the end, because the last 10 questions are the trickiest, and you don't want to miss them. Let's begin. Question 1. A client with suspected Addison's disease has hyperpigmentation and severe fatigue. Which additional finding most strongly supports this diagnosis? A. Hypernatremia. B. Bradycardia. C. Hyponatremia. D. Increased blood pressure. Correct answer? C. Hyponatremia. Rationale? Addison's disease causes low aldosterone, which leads to sodium loss and hyponatremia. Strategy. Addison equals low and slow. Low sodium, low BP, low glucose. Question 2. A client with SAIDH has a serum sodium of 122 milliequivalents per liter. Which symptom should the nurse expect first? A. Seizures. B. Muscle cramps. C. Hallucinations. D. Coma. Correct answer? B. Muscle cramps. Rationale? Early hyponatremia signs include cramps and headaches before neurological deterioration. Strategy. Sodium drops, muscles complain first. Question 3. A diabetic client is cool, pale, anxious, and sweating profusely. Which glucose value supports the suspected condition? A. 250 milligrams per deciliter. B. 160 milligrams per deciliter. C. 55 milligrams per deciliter. D. 120 milligrams per deciliter. Correct answer? C. 55 milligrams per deciliter. Rationale? SNS symptoms plus low glucose equals hypoglycemia. Strategy. Cool and clammy equals give candy. Question 4. A client with hyperthyroidism is being evaluated for thyroid storm. Which finding is most concerning? A. Intolerance to heat. B. Loud heart murmur. C. Heart rate of 168 BPM. D. Weight loss of 6 pounds. Correct answer, C. Heart rate of 168 BPM. Rationale? Extreme tachycardia is a dangerous sign of thyroid storm. Strategy. Thyroid storm equals high, high, high vitals. Question 5. A client with Cushing syndrome has purple striae and a buffalo hump. Which lab value confirms the disorder? A. Low ACTH. B. Decreased cortisol. C. Elevated cortisol. D. Low blood glucose. Correct answer, C. Elevated cortisol. Rationale: Cushing's equals excessive cortisol. Strategy: Cushing equals cushion of cortisol. Question 6. A post-operative thyroidectomy patient reports tingling around the mouth. What electrolyte imbalance is suspected? A. Hyperkalemia. B. Hypocalcemia. C. Hypernatremia. D. Hypoglycemia. Correct answer: B. Hypocalcemia. Rationale: Thyroid removal may injure parathyroids, which leads to low calcium, leading to tingling, tetany. Strategy: Tingling lips equals low Ca. Question 7. Which symptom best differentiates myxedema coma from regular hypothyroidism? A. Fatigue. B. Dry skin. C. Low temperature. D. Constipation. Correct answer: C. Low temperature. Rationale: Severely low temp is a hallmark of myxedema coma. Strategy: Hypothyroidism slowed, myxedema frozen. Question 8. A diabetic client on insulin has Kussmaul respirations. Which condition is most likely? A. HHS. B. DKA. C. Hypoglycemia. Or D. SIADH. The correct answer is B. DKA. Rationale: Kussmaul breathing indicates metabolic acidosis. DKA. Strategy: Deep rapid breathing equals acid leaving. Question 9. Which finding indicates a complication of desmopressin DDA-VP therapy for diabetes insipidus? A. Increase in urine output. B. Systolic BP of 110. C. Serum sodium 128. Or D. Urine-specific gravity 1.025. The correct answer is C. Serum sodium 128. Rationale: Water retention to dilutional hyponatremia. Strategy: Too much DDA-VP equals too much water. Question 10. A client presents with exophthalmos and tremors. Which diet instruction is appropriate? A. Increase fiber. B. Avoid caffeine. C. Increase fluids. Or D. Reduce sodium. The correct answer is B. Avoid caffeine. Rationale: Hyperthyroidism to hypermetabolic state to caffeine worsens excitability. Strategy: Too fast. Avoid stimulants. Question 11. A client with adrenal insufficiency is prescribed hydrocortisone. Which symptom suggests the dose is too low? A. Weight gain. B. Moon face. C. Fatigue and hypotension. Or D. Hyperglycemia. The correct answer is C. Fatigue and hypotension. Rationale: Low cortisol to Addison's symptoms persist. Strategy: Low cortisol equals low energy, low BP. Question 12. A nurse notes carpal spasm during BP cuff inflation. What disorder does this suggest? A. Cushing's syndrome. B. Hyperparathyroidism. C. Hypoparathyroidism. D. Hyperaldosteronism. Correct answer, C. Hypoparathyroidism. Rationale: Trousseau sign, hypocalcemia. Strategy: spasm equals low calcium. Question 13. Which assessment finding is most consistent with pheochromocytoma? A. Bradycardia. B. Persistent hypotension. C. Severe headache with hypertension. D. Hypoglycemia. Correct answer, C. Severe headache with hypertension. Rationale: tumor secretes catecholamines, episodic hypertension. Strategy: pheo equals pressure. Question 14. A client with hyperaldosteronism is being evaluated. Which finding supports the diagnosis? A. Hyperkalemia. B. Hypertension. C. Weight loss. D. Increased urination. Correct answer, B. Hypertension. Rationale: aldosterone causes sodium retention equals up BP. Strategy equals add sodium. Question 15. A nurse suspects DKA rather than HHS. Which finding differentiates the two? A. Elevated glucose. B. Polyuria. C. Ketones in urine. D. Dehydration. Correct answer, C. Ketones in urine. Rationale: only DKA has significant ketone production. Strategy: ketones equals DKA. Question 16. Which lab finding is expected in hyperparathyroidism? A. Low calcium. B. Low PTH. C. High calcium. D. Low sodium. Correct answer, C. High calcium. Rationale: PTH equals pulls the hard stuff, calcium. Question 17. A client with hypothyroidism increases levothyroxine dose unexpectedly. Which symptom indicates overdose? A. Cold intolerance. B. Slow pulse. C. Anxiety and sweating. D. Weight gain. Correct answer, C. Anxiety and sweating. Rationale: too much thyroid hormone leads to hyperthyroid signs. Strategy: too much levo equals too fast. Question 18. A nurse reviews labs for a diabetic client. Which value requires immediate intervention? A. A1C 6.8%. B. Fasting glucose 120. C. Glucose 412. D. A1C 5.9%. Correct answer, C. Glucose 412. Rationale: dangerously high glucose leads to risk of DKA or HHS. Strategy: over 400 equals critical. Question 19. Which finding indicates improvement in acromegaly after treatment? A. Deepened voice. B. Reduced shoe size. C. Normalized IGF-1. D. Enlarged hands. Correct answer, C. Normalized IGF-1. Rationale: IGF-1 best indicator of GH activity. Strategy: IGF-1 equals improvement gauge. Question 20. A client has a thyroid nodule. Which finding suggests malignancy? A. Soft, mobile nodule. B. Painful nodule. C. Hard, fixed nodule. D. Cystic nodule. Correct answer: C. Hard and fixed nodules are more suspicious for cancer. Strategy: hard plus sticky equals suspect. Question 21. A client is being evaluated for diabetic ketoacidosis. Which potassium value is most expected on initial presentation? A. 2.9 milliequivalents per liter. B. 3.5 milliequivalents per liter. C. 5.8 milliequivalents per liter. D. 6.2 milliequivalents per liter. Correct answer: C. 5.8 milliequivalents per liter. Rationale: in DKA, potassium shifts out of cells, causing falsely high serum potassium. Strategy: DKA equals high K at first, drops later when treated. Question 22. A client with SIADH has a urine-specific gravity of 1.035. What does this indicate? A. Excessive fluid loss. B. Dilute urine. C. Concentrated urine. D. Renal failure. Correct answer: C. Concentrated urine. Rationale: SIADH equals water retention equals low output equals concentrated urine. Strategy: SIADH equals soaked inside. Question 23. Which finding requires priority action in a client with hyperthyroidism? A. Soft bowel sounds. B. Temperature of 100.8 degrees Fahrenheit. C. Fatigue. D. Increased appetite. Correct answer: B. Temperature of 100.8 degrees Fahrenheit. Even slight fever may indicate thyroid storm in hyperthyroid patients. Strategy: fever plus hyperthyroid equals emergency. Question 24. A client with untreated hypothyroidism is at greatest risk for which complication? A. Hypertensive crisis. B. Myxedema coma. C. Thyroid storm. D. Cushing crisis. Correct answer: B. Myxedema coma. Rationale: severe hypothyroidism can progress to life-threatening myxedema coma. Strategy: very slow coma. Question 25. A client with Cushing syndrome has thin skin and fragile vessels. Which electrolyte finding is most consistent? A. Hyperkalemia. B. Hypokalemia. C. Low sodium. D. Low cortisol. Correct answer: B. Hypokalemia. Rationale: excess aldosterone-like effect to potassium loss. Strategy: Cushing equals cushy sodium, low potassium. Question 26. A nurse assesses a client with diabetes insipidus. Which finding is expected? A. Weight gain. B. Bradycardia. C. polyuria, D. hyponatremia. Correct answer, C. polyuria. Rationale: diabetes insipidus equals massive urine output due to lack of ADH. Strategy: DI equals dry inside. Question 27. A client with Graves' disease presents with prominent eye bulging. What is the term for this finding? A. Nystagmus, B. Ixophthalmalis, C. Ptosis, D. Mydriasis. Correct answer, B. Ixophthalmalis. Rationale: eye bulging is a hallmark of Graves' disease. Strategy: Graves equals big eyes. Question 28. A client taking metformin is scheduled for a CT scan with IV contrast. What should the nurse do? A. Give the scheduled dose. B. Hold metformin before procedure. C. Increase fluid restriction. D. Give insulin instead. Correct answer, B. Hold metformin before procedure. Rationale: contrast plus metformin equals risk of lactic acidosis. Strategy: contrast, hold metformin. Question 29. A client with parathyroidism is at risk for which complication? A. Tetany, B. Seizures, C. Pathological fractures, D. Muscle twitching. Correct answer, C. Pathological fractures. Rationale: high PTH pulls calcium out of bones, weak bones. Strategy: high Ca equals fragile bones. Question 30. A client with acromegaly has excess growth hormone. Which physical change is expected? A. Short stature, B. Small hands, C. Large facial features, D. Decreased foot size. Correct answer, C. Large facial features. Rationale: GH excess enlarges hands, feet, and jaw. Strategy: acromegaly equals adult enlargement. Question 31. A nurse is reviewing adrenal crisis symptoms. Which is most expected? A. Hypertension, B. Hyperglycemia, C. Severe hypotension, D. Weight gain. Correct answer, C. Severe hypotension. Rationale: lack of cortisol equals vascular collapse. Strategy: Addison's crisis equals BP crash. Question 32. A client with HHS differs from DKA in that HHS presents with A. Ketone production, B. Metabolic acidosis, C. Extremely high glucose, D. Kussmaul respirations. Correct answer, C. Extremely high glucose. Rationale: HHS has very high glucose above 600 without ketones. Strategy: HHS equals higher sugar. Question 33. A client with Addison's disease takes corticosteroids. What instruction is essential? A. Take medication only when symptomatic. B. Discontinue if swelling occurs. C. Do not stop medication abruptly. D. Avoid all sodium intake. Correct answer: C. Do not stop medication abruptly. Rationale: stopping steroids suddenly equals adrenal crisis. Strategy: steroids equals taper. Question 34. A client with suspected diabetes insipidus has urine-specific gravity of 1.002. What does this indicate? A. Concentrated urine. B. Normal finding. C. Dilute urine. D. Renal failure. Correct answer: C. Dilute urine. Rationale: DI equals inability to concentrate urine. Strategy: DI equals drip, drip, drip. Question 35. A client with hypothyroidism begins levothyroxine therapy. Which sign indicates the dose is too high? A. Depression. B. Weight gain. C. Cold intolerance. D. Tachycardia. Correct answer: D. Tachycardia. Rationale: over-replacement mimics hyperthyroidism. Strategy: fast equals too much thyroid hormone. Question 36. Which finding is most concerning in a client receiving insulin therapy? A. Blood glucose 200 milligrams per deciliter. B. Warm, flushed skin. C. Confusion and slurred speech. D. Increased hunger. Correct answer: C. Confusion and slurred speech. Rationale: signs of severe hypoglycemia, brain at risk. Strategy: brain changes equals bad. Question 37. A nurse monitors a client with hyperaldosteronism. Which electrolyte imbalance is expected? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. Or D. Hypercalcemia. Correct answer: A. Hypokalemia. Rationale: excess aldosterone causes potassium loss. Strategy: aldosterone equals potassium out. Question 38. A client with suspected thyroid storm may present with which symptom? A. Low blood pressure. B. Very high fever. C. Cold, clammy skin. Or D. Slow heart rate. Correct answer is B. Very high fever. Rationale: thyroid storm equals hypermetabolic state with high fever. Strategy: hot plus fast equals storm. Question 39. A client with type 1 diabetes reports nausea and abdominal pain. Which action is most appropriate? A. Skip insulin dose. B. Check urine ketones. C. Increase carbohydrate intake. Or D. Avoid fluids. Correct answer is B. Check urine ketones. Rationale: GI symptoms plus diabetes equals suspect DKA. Strategy: sick and diabetic equals check ketones. Question 40. A client with chronic steroid therapy develops a round face. This finding is known as A. Moon face. B. Buffalo hump. C. Cushing ulcer. Or D. Thyroid mask. Correct answer is A. Moon face. Rationale: steroids equals fat redistribution. Strategy: steroids equals swollen face. Question 41. A client with DKA is started on IV insulin. Which lab must be monitored closely? A. Sodium. B. Potassium. C. Magnesium. D. Chloride. Correct answer is B. Potassium. Rationale: insulin pushes K back into cells, risk of hypokalemia. Strategy: insulin equals potassium shift. Question 42. A client has a goiter. Which assessment is priority? A. Voice changes. B. Skin dryness. C. Appetite level. D. Bowel pattern. Correct answer is A. Voice changes. Rationale: could indicate airway compression. Strategy: goiter equals airway watch. Question 43. A client with panhypocalturism is most likely to have which symptom? A. Excessive growth. B. High cortisol. C. Infertility. D. Tachycardia. Correct answer is C. Infertility. Rationale: pituitary regulates reproductive hormones. Strategy: no pituitary equals no sex hormones. Question 44. A client has acute hypercalcemia. Which intervention is appropriate? A. Reduce fluid intake. B. Administer IV fluids. C. Avoid mobility. D. Increase calcium-rich foods. Correct answer is B. Administer IV fluids. Rationale: fluids help flush calcium out. Strategy: high Ca equals hydrate. Question 45. Which finding indicates improvement in SIADH? A. Weight gain. B. Sodium 118. C. Increased urine output. D. Decrease in thirst. Correct answer is C. Increased urine output. Rationale: SIADH equals low output. Improvement equals more output. Strategy: more P equals less ADH effect. Question 46. A client with Hashimoto's disease is most likely to develop which disorder? A. Hyperthyroidism. B. Hypothyroidism. C. Addison's disease, or D, pheochromocytoma? Correct answer is B, hypothyroidism. Rationale, Hashimoto's destroys the thyroid. Strategy, Hashimoto equals slow thyroid. Question 47. A client receiving IV insulin for DKA begins to have a decreasing blood glucose level. What must also be added to the IV fluids? A, potassium, B, sodium bicarbonate, C, 50% dextrose, or D, 5% dextrose. Correct answer, D, 5% dextrose. Rationale, prevent hypoglycemia while continuing insulin to resolve acidosis. Strategy, when glucose decreases, add D5. Question 48. A client with hypoparathyroidism is most likely to experience which symptom? A, kidney stones, B, bone pain, C, tetany, or D, constipation? Correct answer, C, tetany. Rationale, low PTH equals low CA leads to neuromuscular irritability. Strategy, low CA equals twitchy. Question 49. A client with hyperthyroidism reports diaphoresis and weight loss. Which lab confirms the diagnosis? A, elevated TSH, B, low TSH, C, low T3, T4, or D, high calcium? Correct answer, B, low TSH. Rationale, high thyroid hormone causes negative feedback, TSH drops. Strategy, high T3 equals low TSH. Question 50. A nurse assesses a client with adrenal insufficiency. Which dietary recommendation is most appropriate? A, low sodium, B, high potassium, C, high sodium, or D, low carbohydrate? Correct answer, C, high sodium. Rationale, Addison's equals low aldosterone, leads to sodium wasting. Strategy, Addison's equals add sodium. Great job making it to the end. If you scored 40 or higher, you're already performing at a high-level Nclex standard. If not, don't worry. Rewatch, take notes, and your improvement will be massive. Tell me your total score in the comments so I can track your progress and create even more targeted practice questions for you. And if you want more confusing Nclex questions in any topic, med-surg, pharma, mental health, pediatrics, OB, case studies, just let me know and I'll create them. See you in the next video. Keep practicing, keep pushing, and keep preparing like a future RN.